Hello everyone, this is Lan Wang with the College of Architecture and Urban Planning, Tongji-University. Thanks a lot for the invitation from Hannover Confucius Institute. It is my great pleasure to share with you my research and practice in healthy city. I will start with concept and the theoretical framework of healthy city, and then discuss with you about urban planning as public policy for health, and then share with you the evidence-based practice of healthy city planning in Shanghai. And last, I want to summarize how we could do toward a healthy city. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It is influenced by the multiple layers of environment and context. This is also why, when Healthy City was proposed in 1984 and defined in 1994, physical and social environments are highlighted. So when we talk about a healthy city, we need to understand that the virus of urban space, such as central business district, industrial park, and school campus, has its impact on health outcome. There are basically two pathways of this impact. The first one is urban space influence active lifestyle and then influence the chronic non-communicable disease, such as diabetes. And then the second pathway is that urban space may decrease the possibility of the epidemic of infectious disease through spatial intervention and prevention. When we talk about the first pathway of chronic non-communicable disease, there is a term that we cannot avoid: physical activity. It is defined as any bodily movement produced by the skeleton muscles that requires energy expenditure. There are many types of physical activity, such as leisure time physical activity, transportation physical activity, occupational physical activity, and when you're doing your house cleaning, it is called household physical activity. According to the World Health Organization, we should at least have 150 minutes of physical activity per week. And each year, there are many people died because of the NCDs and because of the physical inactivity. And just because of the NCDs are mainly determined by the lifestyle and working status of the local residents, it is also why that urban space has such a big impact on it. Mental health is also very important and can be influenced by urban space. Stress in urban life, long-distance commute, and crowded housing are all related to urban space and can increase mental illness. What we can do then is to promote social interaction in living, working, and leisure spaces. There are so many types of urban space can promote social interaction, such as parks and corner stores. Because of the internet, social interaction can happen in the cyberspace. But the real urban space is even more important and need innovation to promote the offline interaction for better mental health. So in the pathway of the chronic non-communicable disease, the conditions of our existence influence our health on the daily basis. In the pathway of infectious disease, the spatial prevention and the intervention should focus on the three key components of infectious disease: They are source of infection, transmission of the virus, and the susceptible population. Urban space can influence the three key components of infectious disease at the micro and macro level. At macro level, urbanization, desertification, and large-scale construction projects can affect the distribution of population and their lifestyle. The globalization supported by the transportation and telecommunication technology changed the distance of space and then the way of transmission of the virus. At micro level, the wind speed among buildings, population density, and the ways of contact can affect the speed of transmission too. It is why there are questioning and criticism about high-density cities after the breakout of novel coronavirus. So the understanding of healthy city concept brings us to think about the healthiness of urban space besides its economic contribution. The two pathways provided the theoretical framework to guide the research and practice of healthy city. We should promote healthy city development through public policies such as urban planning. So I will talk about the initiative of urban planning as public policy for health in the historical perspective, and then show you the function of urban planning in healthy promotion. You may know that the studies of the impact of built environment on public health has long existed, with infectious diseases as the initial focus. And urban planning was initiated as public policy to deal with the sanitation and basic public health issues in industrial cities. John Slow, the founder of the modern epidemiology, discovered that the epidemic of cholera in London was related to the contaminated water pumps, one of the urban public facilities. Later on, urban planning emerged to arrange the public facilities such as drainage system and parks. In the United States, the industrialization brought the similar public health challenge to local governments. And then zoning ordinance, as one of the most important formats of urban planning, was created to guide the building layouts and heights in order to ensure sunlight and the vegetation. The key indicators in zoning include floor area ratio, building density, and setback. It is similar to the regulatory detailed planning in China and the B-plan in Germany. With the urban development guided by urban planning, the incidence of infectious diseases dramatically decreased. And then the linkage between urban planning and public health has been weakening. With the increase of the NCDs, such as diabetes and respiratory disease, the WHO proposed healthy city concept in 1980s and then initiated the global health movement. The reason is that urban planning as public policy is believed having impact on the lifestyle of residents and then may decrease the incidence of NCDs. So the WHO is calling to rebuild the connection between urban planning and public health in multiple ways. In the field of urban planning, we call it a healthy turn. You may notice the shifting focus of urban planning from the infectious diseases to the NCDs. China joined the global healthy city movement around the 1990s in a way called Hygiene City Program, with a focus on sanitation and basic public health issues. Later on, around 2010, there was a promotion from Hygiene City to Healthy City. In 2012, a strategic plan titled Healthy City 2020 was announced. In 2015, Healthy City was formally promoted as a national strategy. And then we have Healthy China 2030 in 2016, and then Healthy China Initiative in 2019. And in June this year, President Xi Jinping highlighted Healthy in All policy, and specifically integrating health in urban planning. Under the international and national policy background, I also focused on the NCDs when I started my research on Healthy City about 8 years ago. This chart is the Healthy City Planning framework I developed for NCDs. I call it 4 factors and 3 pathways. The 4 factors are 4 types of urban space that can be adjusted by urban planning and design. The 3 pathways of spatial intervention include decrease pollution sources and its human exposure, increase physical activity and social interaction, and provide accessible health facilities. Urban planners could improve the 4 spatial factors to influence physical and mental health of human beings through the 3 pathways. This framework of healthy city planning was adopted by the Sourcebook of Integrating Health in Urban and Territory Planning, announced by the WHO and UN Habitat in 2020. This framework provided the guidance to conduct empirical studies. So this is the research under the first pathway regarding pollution resources and human exposure. I developed a statistic model to capture the relationship between lung cancer incidence of communities and spatial factors in Shanghai. The research outcome proved that mixed-use road density and green space configure influence respiratory health of human beings. So how we plan the city matters. The NCDs, such as lung cancer, are gradually developed along the lifetime. So the living conditions shaped by our policies played a really significant role. For the second pathway, I focused on the diversity of physical activity and green space. Our research team conducted field observation on the selected sample sites to connect the data about the physical activities as well as site and vegetation characteristics. The research outcome provided detailed design principles for green space to promote physical activity. It is interesting to find out that the shape of sites does not matter. While the green coverage ratio has significant positive correlation with physical activity, the green vision rate has significant negative correlation. It means certain balance is needed between sky and trees in the design of a small park. Under the third pathway regarding health facilities, I examined the spatial distribution of community sports facility and community senior healthcare facility from the perspective of health equity. Evaluation was conducted on the floor area and accessibility of those facilities. Areas with significant insufficiency were identified based on the spatial analytical software GILDA, and the Gini index was calculated for different types of facilities. Then urban planners could know where and which facilities should be added in the new plans. Health equity is so important and influenced by our policies regarding the allocation of health resources. This research therefore provides a method to access the health equity regarding the spatial distribution of important health facilities. The three empirical researches are all about NCDs. Regarding the infectious disease, our research team conducted normative research. Some empirical studies are undergoing too. In the normative research, we proposed to establish public health unit based on the 15-minute community life circle. It means that we provide facilities and services of daily health and public health emergency preparation within walking distance for local residents. It is also important to consider the adaptation of those daily health facilities during the pandemic outbreak. The supply of service for daily life and healthcare during the pandemic is crucial. Communities need to provide sufficient support for quarantine. Facilities within walking distance need to be carefully considered and planned. This chart shows the spatial pattern we drafted for the 15-minute community life circle. Based on those researches, our team also got involved in real consulting projects to implement evidence-based practice of healthy city planning. I will show you one of the projects to illustrate the procedure and the focus of healthy city planning. Our team called Healthy City Lab has conducted different types of planning projects. The one I choose to share is a healthy-oriented micro-regeneration design for a neighborhood park in Shanghai. It has been listed as a best practice of healthy design by the World Bank, and I am working on the case report right now. It has been implemented, and local residents like the new park a lot. The site is located at the center of a community called Kainu New Village in the southeast of Shanghai. It was developed around the 1980s. The public facilities and green space need renovation today for the increasing demand of quality of life. This is the bird view of the site before the redevelopment. Trees were covered all the site, as you can see. At the beginning of design procedure, we conducted a survey and field observation to understand healthy demand of local residents. We examined the temporal spatial behavior of various groups of space users and identified their preference and habit. It was discovered that over 70% of space users were elderly people, and the peak time of this park was after the school hours. It is important to analyze the healthy risks on the site and then adjust it through urban design. So we conducted wind simulation to identify the strong wind spots and the static wind spots. For the strong wind spots, we may design certain elements to slow it down, and for the static wind spots, we need to avoid it overlay with pollution sources. Then we conducted sunlight simulation to find out spots with sunshine less than 1 hour on the winter solstice day, where we need to adjust it for sure in the design. So we recommended to remove certain trees for better sunshine. It was also supported by our empirical study about physical activity and green space, in which it was highlighted that the balance between the sky and trees will be important for promoting physical activity. So overall, we developed a plan with multiple functions to meet the demand of local residents and decrease the health risks. For instance, we combined the performance stage at the central square with another function of wind shelter. We noticed that the seniors like to get together after their daily grocery shopping, and then we designed certain space for them to meet. We also designed parents-children interaction zone to promote exercise for all of them. So the overarching goal of this design is health for all ages. Those are the pictures taken during the event. 5 teams of children developed their own plans with toys on the site map. We also introduced the hand-mold bricks made by the students during the event, and they would like to And last, we conducted a health impact assessment, HIA, for the proposal of the site. The increased facilities and improved health resources were identified. The decrease of the health risks were confirmed. The preparedness for the pandemic has also been considered. The central park of this community has been improved by this health-oriented design. So this project illustrates the procedural and components of healthy city planning and design. We shall analyze healthy demand, health risk, and healthy elements and resources to achieve health equity. Pollution control, allocation of health resources, and promotion of walkability are important components for healthy urban design. The detailed design need to consider the local context and the preference of local residents. Health impact assessment is a significant policy tool to understand and deliberate the health impact of certain projects or plans. Therefore, we should plan toward healthy cities. A healthy city is not only a healthy city is not only a system of infrastructures and medical institutions, but also the urban system that provides a micro and long-term promotion for public health. We could work on the two pathways to decrease the NCDs and infectious diseases through urban planning. WHO highlights that health must be a top priority for urban planners. As public policy, urban planning should play its crucial role to achieve health promotion and health equity. Both hardware and software need to be considered in urban planning and governance. What our Healthy City Lab is doing is to conduct and integrate empirical research, planning and design practice, and health impact assessment. More specifically, we focus on respiratory health, health facility distribution, walkability, and cycling. For the practice, we are working on health design guidelines and a criteria system, as well as planning and design projects for different spatial scales. Those are the books, and the sourcebook may provide more information about healthy city. For instance, this one, Integrating Health in Urban and Territorial Planning, a sourcebook, could be downloaded from the website of the WHO and UN Habitat. That is all for my little talk. Please contact me by email if you have further questions or willingness to cooperate. Healthy City Lab welcomes any cooperation to promote healthy city planning and development. We believe that healthy city is so important for all of us. Health in all policy should be implemented, and urban planning is one of the important public policies to support healthy city. Let us develop healthy city all together.